you go. Okay. All right. Good morning, everybody. Welcome to our fourth annual legislative forum on prevention topics. We are here today because we, the members of the various prevention coalitions, would like to update our legislators on the current issues affecting youth substance misuse in our communities, and we're here to discuss policy solutions with you. Our goal for today is for the members of our local prevention coalitions, which is pretty much we have representatives here today from, I think, 10 different prevention coalitions. And our goal is for us to update our elected officials on issues that our communities are dealing with individually that could be better solved at the state level. And for our legislators to use this opportunity to gather more information from all of us who have our boots on the ground and different perspectives coming from different sectors so that we can allow you to put forward good policy solutions starting next month when you get back to the Capitol. So I'm Margaret Watt. I'm the prevention director here at Positive Directions, the Center for Prevention and Counseling in Westport. I am on the leadership team of the prevention councils in Norwalk and Westport, as well as a member of the Fairfield Prevention Coalition. And everyone you hear speaking today is a member of their local prevention coalition. I want to give a shout out to our planning team today, which involved members of the prevention coalitions from New Canaan, Norwalk, Trumbull, Weston, Westport, and Wilton, in coordination with the Stamford Greenwich coalitions, and of course, our regional partner at the Hub. What I'm going to do now, and I see Rep. Steinberg has joined us. Thanks, Jonathan, for being here. Let me share my screen. And so I'm going to quickly tell you what our agenda is today and make a quick grant announcement, and then you'll be able to we'll talk through these various issues. So right now we're doing some opening remarks. Melissa from the Hub is going to explain what local prevention councils are for anyone who's unaware, since I just mentioned that about 6 times. And then we're going to focus today on a few different topics, primarily illicit sales at smoke shops, which is something all our communities are dealing with. And again, a state policy response would be very helpful. We are also going to be bringing back a topic we spoke to you about a couple of years ago, which is the fact that our current cannabis laws really kind of enable risky behaviors among youth to continue because there are no formal consequences for youth, unlike there would be for alcohol when they're found, say, in possession. Melissa is going to talk about the THC potency caps because you are going to be hearing about that this session in the legislature from a couple of different perspectives. So we want to ground you in the science. Nicole is going to speak about the silos in substance regulation and enforcement, which are really causing problems down here on the ground where, sometimes the right hand doesn't know what the left hand is doing and folks from the state are coming and not coordinating locally and so forth. And it feels like something that's ripe for addressing. And then we'll wrap up by giving you a heads up on what we know about the funding from the cannabis revenue. So I'll actually give a quick, that'll let me give you a grant announcement. Last year at our legislative forum, one of the things we talked about was the just general lack of funding for any kind of substance prevention or mental health promotion in our communities. This year, I'm very happy to announce that the state has just awarded the first grant funding to local communities statewide coming out of the cannabis tax revenues to date. So we received our awards. We were notified last Friday, and Trumbull here, Melissa McGarry was awarded a grant on behalf of Trumbull, Monroe, and Easton. And here at Positive Directions, we were awarded a grant on behalf of the greater Norwalk sort of cannabis retail market, which is Norwalk, New Canaan, Westport, Weston, and Wilton. So we're excited to have that money coming in. And I'll also give you a heads up that money is
You can leave it open.
$57,000 per grant award. There are 10 awards in the state. So basically the state has taken about, $570,000 out of the cannabis revenues to date and sending it back to the communities. We will present at the end that we believe the state is actually probably took in $10 million this year from that fund in just tax revenue. So that's our agenda for today. And before you start hearing from speakers, and I want to actually mention, you know, people still coming in, want to ask everyone, please introduce yourself in the chat on screen. In the interest of being mindful of everyone's time, especially our legislators, we figured rather than have everyone go around and introduce themselves, please just, put it on the screen, put it in the chat. We are so happy to have you here. So the purpose today is really to talk about substance prevention for, youth, for minors, and why the policies could be, more supportive of their needs. And so I just want to focus quickly on what's happened with cannabis, what the impact of cannabis legalization has been on youth so far. What we know nationally is every state within a couple of years of legalizing adult use marijuana, like we have here, the public perception that marijuana is risky decreases significantly. So a really enormous systematic review and meta-analysis came out at the end of October that found that nationally there was a 13% increase in youth marijuana use in the states that had legalized adult use. Then just because I want to share local data, which is what our prevention coalitions collect, Kids in Crisis from just Westport saw a 25% increase over the course of from one school year to the next in the number of students that they screened for that were reporting really frequent use of cannabis, like more than once a week at least. So use has gone up among youth. Perception of harm among youth related to cannabis has decreased significantly. So we surveyed students in Westport last year, and we're just currently getting our survey data back in Norwalk. Most of our towns have done the same survey. Right now, we saw that just under half of 12th graders think that using cannabis a couple times a week is harmful. But meanwhile, 80% or plus think that other substance use is harmful at that age. So there's a really significant decrease, and those who think it's not risky are more likely to use it. In fact, twice as likely. The reality is cannabis in particular, when used by teens a couple times a week to like 3 or 4, is associated with up to an 8-point IQ loss. It's associated with increased anxiety, risk of suicidal ideation, psychosis, and a big predictor of addiction, because 90% of addiction starts in people who begin using substances before age 18. So the perceptions don't match the reality. And now how this is playing out is that we are seeing more problems when you go to the hospitals. So Norwalk Health Department did an analysis for us this last year. And for Norwalk youth, there was an increase every year for the last 3 years since the RERACA law passed, in underage visits to the emergency room related to cannabis and in THC overdoses. And the most recent rate was double what it had been 5 years before. So this is to give you kind of this background of why we're here today. And now we're going to start talking about the issues. The format for today, actually, Melissa's going to talk to you about what the local prevention coalitions are, and then we'll move on to our topics. What I want to tell you about the format of the topics is we'll have a speaker on each topic who'll just kind of highlight what the issues are and highlight what various policy options could be. And then we would like our legislators to ask us the questions they want to hear, and folks in the room will answer both verbally or in the chat. We want to spend about 10 minutes on each issue. So now, Melissa, if you can just give everyone a quick update on what the prevention coalitions are, that'd be great.
Perfect. Thank you, Margaret, for all your hard work on this. Hi, everybody. Good morning. My name is Melissa Perez-Constantine. I am a program coordinator with Catalyst CT, the Hub, the regional behavioral health action organization for Region 1. So we cover 14 towns from Stratford to Greenwich. But for the purpose of today, I really wanted to talk about our LPCs, our local prevention councils, because they are really the experts of their towns, and they really put hard work into this legislative forum to bring us all of the kind of existing needs that we're seeing and how we can combat that. So just to explain our LPCs, community-based local prevention councils bring together a diverse group of community key stakeholders who represent multiple sectors, including businesses, health and behavioral health care, schools, both public and private, local government, youth serving organizations, civic groups, and others. and they really utilize the strategic prevention framework. So all of the LPCs utilize the federal SAMHSA's strategic prevention framework. It guides all of DEMIS's prevention and health promotion division initiatives to ensure data-driven decision-making, planning, implementation, and continuous improvement to best address existing needs and gaps, whether across the state, in the region or community, a specific setting, or of a particular population. All funded initiatives must utilize the SPIF model, which comprises of 5 elements, which is needs assessments, capacity building, planning, implementing evidence-based strategies, monitoring and evaluation, and it also accounts for sustainability and cultural sensitivity to meet the unique needs of the prioritized populations and communities. So really is a very diverse group of people that have all of their specific knowledge coming together to collaboratively work on the identified problem substance priorities for people of all ages. Today, based on signups, we have folks in attendance from 10 different prevention coalitions, and 11 out of 14 prevention sectors will be in attendance today. So we have a lot of representation, a lot of experts really looking at the grassroots kind of issues that we're seeing nowadays.
Thanks so much, Melissa. That was great. And I want to give a quick shout out to Senator Duff, who I just saw join. Morning, Bob. Please just introduce yourself in the chat. And I'm just re-showing our agenda. So we're going to now talk about our first issue, which is the illicit cannabis and nicotine sales at shops. So Chief Walsh from Norwalk Police Department, take it away.
Good morning, Margaret. Good morning, everyone. As we've discussed in previous partnership meetings, since the legalization of adult use cannabis in 2021, many communities, including Norwalk, have seen a large increase in smoke shops and other retail establishments that sell smoking products and THC. And with that legalization, we've seen a mindset that marijuana is and high THC products is legal for everybody to consume. So here in Norwalk, we're up to like 14 to 16 successful investigations of retail establishments where our investigators go into these retail shops and purchase marijuana directly over the counter. And then we subsequently secure arrest and search warrants. And upon doing that, we're finding significant amounts and pounds of illegal marijuana. So we've actually been there on several occasions and had customers come up to the store and ask the investigators, well, we thought marijuana was legal in the state of Connecticut. It is legal through designated adult use cannabis stores, where in the city of Norwalk we have currently 3 of them, but not over-the-counter sales, as we've seen throughout Fairfield County. Not only Norwalk, Stamford, many other jurisdictions in Southwestern Connecticut have seen a large increase of illegal sales of marijuana, high THC products over the counter, which are all legal. So our investigators team up with consumer protection to identify these high THC products. And usually the bad actors are arrested for, sale of marijuana, possession of marijuana, which are very minor offenses. And we lack the, shall I say, the civil ramifications on the state level and to pursue further punishment against the retail owners, which are knowingly many of the times engaging in and profiting from illegal sales of marijuana out of these stores. Right now in the city of Norwalk, we have well over 22 smoke shops that we've identified and other small retail organizations, like small gas stations that sell smoking products and other smoking products. So what we've done here in the city of Norwalk and several other communities have done so in Milford, Trumbull, Westport, we've begun to create our own local ordinances to combat this. Our first endeavor here in the city of Norwalk was to limit within 1 mile the opening of a new smoke shop if there was an existing smoke shop in 1 mile radius. And now we're further working on a more robust town ordinance which would require licensing and follow-up termination of their license to sell these products through the health department. This ordinance is currently being drafted and reviewed by the Common Council through Corporation Council, which I'm a part of, and hopefully we'll get that on board in the next 6 months. So right now, more or less, it's continuing. We have investigations continuing right now where the investigators are still buying marijuana over the counter. We'll continue our endeavors here in Norwalk to combat this, but we lack the oversight that would be, which is probably a lot more productive that we see in some cases of illegal sales of liquor in restaurants and bars, of underage sales, over serving, and other regulated liquor sales where we need assistance from state consumer protection to provide more oversight to these retail establishments that are engaging in this activity.
Thanks, Chief. You just made, that was really well highlighted. I see that Rep. Bertiliano's raised his hand with a question. And what I've just done also, Dave, is switch to the screen where we're identifying some possible solutions to this issue so that every town isn't kind of reinventing the wheel, right? Rep. Bertiliano, your question.
Thank you. Good morning. Good morning, Chief. Chief, I was just curious to know that if the bill that we passed last year, giving the local municipalities greater enforcement power, have you found that useful? Are there any things besides that? I understand about the fine and everything, but anything about that specific legislation that needs to be adjusted or changed, or is it starting to work?
I think slowly it's going to begin to work, but a successful model to follow is what consumer protection does with liquor sales and alcohol sales, where there is a progressive scale of fines to the owner. In Norwalk, we've actually arrested the clerk. So if it's 8 o'clock at night, the owner's usually not there. And the owner has to be found responsible for the actions of the clerk at 8 o'clock or 9 o'clock at night, even when the owner's not present. And we found a pretty effective model in dealing with liquor sales and alcohol sales is holding management responsible for either a suspension of their license for several days or a hefty fine.
So do you need state intervention? It sounds like you're going to create sort of a permittee process, right? Where a restaurant would have a permittee for the liquor permit who's ultimately responsible for what happens. Do you need to create that locally, or is that something that you need the state to do?
Well, we're doing that locally right now. Is to create an ordinance to be able to do that model that I just described, where we actually they go through a hearing process and we close them after they have been through due process found that they are violating the law and they are continuing to sell marijuana and they are presenting it probably more or less a public safety. It comes down to public safety. It's a public safety hazard because unlike the 3 adult use retail cannabis stores in Norwalk, their product is regulated and inspected and conforms to state of Connecticut standards. The products that are being sold out of these retail establishments are not regulated. They're not inspected. It's black market marijuana and black market products that at one time was sold on the street through illegal sales. Now it's being sold over the counter. So it's multifaceted because even in the criminal justice model through courts, it is still a very minor offense. It's a minor offense. Marijuana is a minor offense criminally in the state of Connecticut. So
even the intent to sell,
yes,
that's still minor. Okay.
Yes.
Thank you, Chief.
You're welcome.
Thanks, Rep. Bertiliano. And as you can see, I mean, it does feel like some of these are things that should just better be addressed at the state level than locally. I'm so glad, I'm a Norwalk resident. I'm really glad Norwalk is moving forward on, local licensing and the ability to shut down violators. And I know Trumbull was the first to do it back in 2019 for vape shops at that point. But, a few years ago, there were sort of multiple repeat offenders and that we identified in the town, and the health department couldn't really do anything about them, like continuing to sell. This was for nicotine. The law enforcement couldn't, it was like you just fine them and the fines weren't enough to cut into their business model. And now, if town by town, we're trying to like look at, oh, how can we find owners? How can we make the fines meaningful? Can we take a license away? Can we shut things down? If some of that were happening at the state level, I think it would help all of our towns because the issue is going to come up everywhere over and over. So you can see on the screen some of our policy options that we're proposing, any or all of these, and would really love to hear any questions or comments from legislators so that, you know, which of these feels doable to you? What role would you like to take? Rep. Hughes.
Yeah, thank you. This is really helpful. One of the things that we looked at last year, and David Ritigliano can address this, is increasing enforcement from the DCP, which actually has regulation of cannabis products under its purview, and to create more support for DCP to put in additional enforcement. I mean, because what we heard last year, help me out, David, is that it's too much for law enforcement to go after. I mean, they have bigger fish to fry, but I could be wrong. So I'm just wondering about that. And also, yes, we're catching up to Tobacco 21, which was just a couple of years ago as well, and the enforcement of cannabis. I think because the consumers think, oh, it was legalized in Connecticut, it's legalized for everyone, which of course it's not. But we have a lot of folks coming in from New York and, have resettled here, and they don't know the nuances of the laws that were passed, which, by the way, we really want to make sure doesn't disproportionately get enforced on Black and brown communities that have suffered disproportionately from the war on drugs. So that's part of this bill, was trying to create social equity council and to invest back in those communities that were disproportionately harmed by the war on drugs. So we want to be mindful of the spirit of tightening up regulations to include that as well. Thanks.
Thank you for that. When you talk about DCP, I'll just preview that at sort of towards the end of our agenda, Nicole Hampton, who's on the Alcohol and Drug Policy Council, and Kaitlin Comet from the Hub are going to talk a little bit about how the fact that DCP and DEMIS and various agencies are all involved in sort of regulating substances leaves room for gaps and lack of coordination. And sometimes on the ground, we don't know what's happening at the state level and vice versa. And THC beverages that, came out on the market last year, and you guys helped us kind of regulate that. But that's one of those weird things because now they're legally sold in liquor stores and in cannabis retailers. And who's actually monitoring those because they fall under two different agencies? You also asked a little bit, Rep. Hughes, about, the DCP enforcement and whether it was better to come from that side than law enforcement. So I just want to see if anyone, I know we've got some other law enforcement folks here. Anyone want to respond to that from another perspective? I don't see any hands up. Okay. Rep. Rutiliano, just because you've been so active in this arena, are any of the things on the screen here something that you're aware that might be moving forward this legislative session?
So last year, what we did was we tried to sort of streamline enforcement last year. That's why we gave a municipal option so that the local authorities could, even under a CUPTA violation, they could do an unfair trade practice, so that the local police didn't have to wait for DCP or DRS or all these other agencies to go in and take care of it. It has been a question to DCP every year. If they could go in and pull a liquor license from a restaurant, why can't they just go in and pull the license from a smoke shop or something? Because there is license involved. They have to have a tobacco license. Many of them have a grocery license because they sell milk and whatnot. Why can't they just pull that? So we continue to ask those questions. I thought last year's bill was really well thought out. It was years in the making, and we really are just trying to, get the illegal sales quickly taken care of. So, I mean, that's the idea. Rescinded tobacco license. I don't know why they can't rescind the tobacco. I'm going to meet Brian again this week, DCP this week. I'm like, why can't you just go in and pull the license? We don't understand why it takes all this banter. And then we could also set up a liquor commission like we did for alcohol, where they at least have an appeals process. This business can go in front of a board and they could dole out punishment. So there's a lot of conversations going on. We do have new leadership on general law, which we're excited about, who, we've had a lot of talks about the vape and smoke shop proliferation and what they're up to. So I don't know I think establishing the cap on a number of stores, wouldn't that be a local zoning issue?
It could
Margaret?
be, but when the RERACA bill passed initially, which was the first cannabis law, it established something statewide, right? And then that was rescinded. But originally, the RERACA bill said one cannabis retailer per 25,000 population would be kind of the density level. So it could be done at the state level. Then it was rescinded. So now towns are sort of doing it. But I think, as the chief mentioned, what no one really anticipated when the law originally passed, everyone was thinking it's going to be legal cannabis retailers, but the smoke shops weren't really, no one was thinking about that. And I mean, you can drive around any town and see these things popping up everywhere, right?
Agreed. I hear you.
Well, Dave, we look forward to continued conversation with you on this, and please come back to us for any more feedback or input, or let us know how to help on this issue.
Really, the best feedback for me, Margaret, is if any of these things we're doing are working. I thought last year's bill was pretty detailed. We took a major step forward, I thought, and it would be good if we had time for it to sink in and see if there's actually any results, positive or otherwise.
We can definitely feed that back to you at our next forum next year.
Yeah, right.
All right, we're going to move on to talking about something that we haven't brought up the last couple of years. We brought it up a while back, which is, what happens to youth who use cannabis and or what doesn't happen, and why we think it's important for there to be something restorative. So Kevin Godburn from Westport Youth Services.
Thank you, Margaret, and good morning. My name is Kevin Godburn. I'm the Youth Services Program Director here for the town of Westport. I also have the pleasure of being part of the leadership team for the Westport Prevention Coalition. And I just want to speak briefly about what we're seeing and perhaps some of the missed opportunities when it comes to intervention. So what do we know? We know that prevention science emphasizes the importance of ensuring that youth experience some kind of consequence, which doesn't need to be punitive for illicit or dangerous behaviors. We know restorative consequences offer an opportunity for early intervention, and the lack of consequences, as noted earlier, enables the behavior to continue and sends a strong message to youth that it's acceptable. You may recall from the earlier slide, we've seen on a national scale that recreational adult use legalization has had a negative impact on youth use rates, increasing by 13% and then 22% for young adults. And with that increase has also brought concerns for cannabis use disorder. We heard earlier about the real risks that come with youth use, but the low perception of harm, at least what we're seeing here in Westport, with our young people and with our parents. When you combine those factors with the access and enforcement challenges that Chief Walsh outlined so well earlier, we can see how early intervention and prevention education can be so critical. We continue to work with our prevention education efforts and are excited to form this new regional team with Westport, Norwalk, Wilton, Weston, and New Canaan through the Cannabis grant. But we also acknowledge that the current laws perhaps miss some intervention opportunities. As it's currently written, there are no real consequences for the first possession of vapes or cannabis, unlike alcohol or other drugs. The regulation of adult use cannabis laws specify an optional optional verbal warning as a first offense. From our side, the YSBs and JRBs are uniquely equipped to serve our youth and families. Whether we're offering a variety of in-house services or coordinating care through a wide array of partners. But if the referrals aren't coming to us from police or from families, if parents are unaware of the verbal warning, if they're not making it to our organizations until further downstream, then we're delaying those potentially valuable resource connections that we do have. And the impact's not only a missed opportunity for early intervention, but it's also the inability to quantify the problems that we're seeing. I can say in our small sample size, through our JRB in the 3 years prior to legalization, 56% of our cases were cannabis related, either coming through as the primary referral or being involved somehow with or being a cause for concern with the student. And since in the 3 years since legalization, that's dropped to that's now 7% of our referrals, and we haven't seen any in the past year and a half. I know some other JRBs have seen a similar dip, but we have the capacity to help, but we may have lost that channel for referrals. We know that every YSB does not have the same resources. Our CYSA provides a deep network and really affords us an opportunity to collaborate and share, but each YSB and JRB will ultimately face their own obstacles when it comes to whether it's funding or capacity, which often go hand in hand. I mentioned the consequences don't need to be punitive, but one of the 7 key prevention strategies, we know that some form of consequence makes a difference. The latest substance prevention research says to treat all underage substance use as a red flag and act immediately, and not to give warnings or let things slide. So when we get to some opportunities for change, what we ask is that you consider requiring a referral for every instance of underage substance use identified by police. Even if the youth and family doesn't engage with the referral agency, it at least provides us an opportunity to share resources and to begin to build that network of support early on. We also recognize, as I just mentioned, the differences in capacity across communities. So funding needs to be considered for the YSBs, the JRBs, the people handling those referrals, and to consider additional resource funding through the Cannabis Prevention and Recovery Service Fund to help with those counseling and psychoeducation opportunities.
Thank you, Kevin. And I think the Westport example is really interesting in that you've said other youth service bureaus have seen fewer referrals for cannabis for youth, cannabis use by youth since the law passed. I'm sure that doesn't mean that the use is dropping. It just means that the message that's been sent by this law is like, there's really nothing to be done and no one's being referred. I also want to highlight that on the policy options screen that I hope everyone can see, we're suggesting to our legislature that it's really important. We're not suggesting, we're saying it, we know it's important for there to be some kind of impact. If your kid was using weed and got caught and no one said even to them, like, this is dangerous, don't do it, and no one told you and no one told anyone and no one provided early intervention, I think you as a parent, like I know I as a parent would be upset about that. So really one option is this kind of restorative approach where it's like referring them for positive services, screening, psychoeducation, and connections. A different option that Kevin sort of didn't mention that we've listed as number 2 is you could also just say, well, let's have the same kind of consequences for underage cannabis possession as for alcohol, but those are more punitive, right? The kids get fined, and there's an impact on either getting their driver's license or having it for a while. But we do, a kid caught with alcohol has some kind of consequence. There is some kind of message that society doesn't think that that's acceptable, healthy, or legal. So I'd like to see if there are any comments or questions from any of our legislators about this or anyone who thinks that they would like to go back and work on this. I know that Rep. McCarthy Vahey, as co-chair of Public Health, is someone we're going to be following up on this with. Anyone else or any questions or comments from the room?
Margaret?
Yeah. Oh, is that
Hi,
Sal?
Sal, how you doing?
Hey.
Yeah, hi. Good morning. Is there a way that, we can, not punitive as Kevin said, is there a way we can give a warning, a written warning, or have them talk to parents? Have they done that with these issues? Locally with our police and our in Norwalk or any of these towns?
So yeah, and I know you're on your phone, Sal, so you can't see the screen, but what we're really hoping is that the legislature can put something into effect where it's required that there be some kind of like if it's a warning, but maybe a warning, but also with a referral where we're saying you have to now see someone who can screen you and figure out what's going on. Why are you using the substance? Is it a mental health? Is it a substance issue? Provide resources, provide some education. The other thing it would do if there is a referral process is it would allow, even if a kid doesn't show up for the referral, just the act of providing the referral means we would have some ability to track how often this is happening. Right now, we have zero idea.
And as we've discussed, before, one of the issues, as Margaret just alluded to, with the verbal warnings, there's no system to track. So in theory, a kid could get a verbal warning in Westport and Weston and Wilton and Canaan, and just collect those warnings before they eventually are potentially referred to a JRB or somebody who can provide resources and services to help.
Any comments or questions on this topic? And in particular, if there are any legislators who think, this is not necessarily what we had in mind. This isn't how we treat alcohol use. So maybe there should be some form of revision of the statutes. I see Tony Boucher.
Good morning. Sorry that I was delayed in getting onto this call. As you know, I've been pretty outspoken on the whole issue of marijuana use and substance abuse for many, many years. And I've backed off of that and had so many other things to focus on. But unfortunately, it's becoming increasingly a problem within our society. In fact, there was just a recent, very well publicized news article that Elton John, a very famous celebrity musician and so forth, has come out with a very strong statement because he was a user, he was an addict, and he has tried to help so many of his high profile friends in that industry with trying to recover from that substance abuse. He basically said unequivocally that the biggest mistake ever made by the countries of America and Canada was to legalize marijuana, and that for him, it was addictive. It does lead to more widespread use of higher drugs. We are seeing that in our classrooms, in every community, not just in the inner city, but all of our communities, that this is being, there's vaping going on in bathrooms. God knows what's in those vape pipes. There's the distribution of it. The pot stores are opening up all over the place. Norwalk and Wilton, we have many applications, even though, we have banned the sale of marijuana, but it only was, banned 5 out of 9, and 3 voted, for it. So again, there's not really good information for people to understand the seriousness of this entire topic. So I think anything you can do to encourage legislators to at least make sure that there are high consequences for them, because when there were, and it was illegal, there was a lower usage. And in Norwalk, I heard from the expulsion officers there that they saw a dramatic increase in use in the classroom as soon as Connecticut legalized pot.
Thank you so much for that statement. Yeah. Is there anyone else who'd like to comment on this? Okay, well, I do hope we can do something about it because like you just said, Tony, sending a strong message, having a law that says kids can't use this stuff and then doing nothing when they're found using it is a very strong message that we really aren't serious about the age limit. Okay, we're going to move on to THC potency caps, which Connecticut is one of 3 states that has implemented. And Melissa McGarry is going to talk about why it's important and what's going to come up in the legislature this year.
Good morning. Thanks everyone for your time today. I've been working in prevention for 20 years and for the last 18 in Trumbull. And one of the reasons we're so concerned in the prevention community about today's THC is the fact that it has been engineered for maximum potency and maximum profit and maximum addictiveness. And we do thank our legislators who in the original RARACA bill took the very decisive steps to put potency caps in. We are a leader amongst our peers. For those of you who don't know, we capped plant THC at 30%, concentrates at 60%, which is wonderful because in many states we see concentrates at nearing 100%. And we capped the amount of THC per edible serving. What the law does do that many of us were dismayed to see is it specifically excludes pre-filled vapes from potency caps. And if you take a look at our legal cannabis retailers in the region and you look at what they're selling, they are not selling. I was unable to find a single store selling a vape at under 70% THC. Many of them higher than that. Unlicensed sellers are selling, those smoke shops and other unlicensed black market sellers are selling products way above these limits. And I work in a school district. Many of us work in the school district, as the Wilton First Selectman mentioned. What we're finding in our schools are often north of 90% THC vapes. So kids with 95%, 96%, 97%. All of these high potency products have been identified. The growing body of evidence, it comes out nearly weekly, the body of evidence that these products, these high potency products, the effects that they have on physical health, mental health, especially for young people who have developing brains. And these products, the higher the potency, the more likely they are to be targeted and marketed to our young people. So I think the strongest message is we want to stay strong on our potency caps. The industry will tell you that they can't compete with potency caps, that they can't compete with other states, that it cuts into their business model. But these potency caps are absolutely critical staying in place. But the fact of the matter is researchers identify anything over 10% as high potency. And anything over 10% has been shown, particularly with psychotic young people exhibiting symptoms of psychosis, that anything over 10% increases the likelihood of a psychiatric impact significantly. And for those of you, I also would urge you to talk to people that are working in the treatment field, because many of them are, people who have been working in mental health for many years will report that they are seeing a dramatic increase in clients presenting with both mental health concerns and cannabis use disorder. So I think that's something we want to just make sure that we're supporting our legislators and we're encouraging them to stay firm on our potency caps, because they really, they're higher than what research may show. So in terms of policy options, if nothing else, please don't give in to the industry urging you to relax our potency caps in our legal marketplace. The science would certainly dictate that it might be worth considering lowering those THC potency caps. We know that there are some legislators in other parts of the state who are looking to introduce bills to lower the potency caps in line with the science. We would also really encourage the state to apply potency caps to those pre-filled disposable vapes to bring them in line with the other products. There's no, I have not heard a justifiable reason why this exclusion was specifically written into our law. So that's something we would love to see considered. And then the fact that these disposable vapes not only present with high potency THC, but they also present with the health impacts of vapes themselves. And we're seeing a movement. There is a movement internationally to ban disposable vapes. The United Kingdom has announced that they will be banning these devices in the coming, I think in the next year, 18 months. So we would love to see Connecticut take a stand against these products, since they are so clearly targeted to our young people and they carry such severe impacts for their health and well-being.
Thanks, Melissa. Yeah, we would love to hear legislators comment on this. Like Melissa said, you're probably going to see competing bills in the legislature this year, where some folks are going to say lower the potency caps and others are going to say we don't need potency caps. But there really is an impact on our youth. Would anyone like to speak to this from the legislative perspective or anything to add from the room? I don't see any hands up.
I'll ask a quick question if you don't mind. The thing I hear the most is they want to standardize the potency caps to match the medical with the adult use market. That's the one I hear the most. They say that we're putting one of the industries, I'm not agreeing with it, by the way, I'm just telling you what I'm hearing over and over and over again. They sort of want to make the caps the same, where they say that one market is at a disadvantage because the other one has a higher potency.
Mm.
You mean the retail market is saying that the medical marijuana people can sell it higher?
Yeah, they want to, right. They say they're losing market share because I actually thought it was the medical folks that were complaining that the retail market was higher because the medical has been losing market share. And so I didn't know if we had an opinion or a standard answer or. And just on a side note, I know this isn't that type of forum, but there's very few people I miss in the legislature more than Tony Boucher, who was an unbelievable ally to all of us. So,
and she has her hand up again. So
yeah,
please,
good.
Black woman, go ahead.
Well, I think this discussion is really important. If in fact medical marijuana did research about what are the safe levels, okay, and caps to use, it is the private market that's out of line. The private market needs to reflect the lower caps. And that's the response I would give, Dave, that is clearly, harming, more harmful even to just healthy users, and can potentially make them then unhealthy users and be devastating. So if in fact the medical market is being, governed by certain standards, that how much can be dispensed if someone's really sick, so as not to harm them further, then what are we doing, in the non-medical marijuana world? Okay, we're actually working to harm people even more. So I would just turn it around, Dave, on them vigorously and fight that tooth and nail. And I'm not up there fighting with you, but I'm with you in spirit, and we depend on you to do that. Unfortunately, it's often crickets when you're talking about these things, and people depend on the outspoken person that's willing to take a stand because they're afraid of controversy and about it. And I would be bold in this because it's the health of not just the adult users, but too often it falls into the hands of children, some as small as toddlers that ingest gummies and are taken to emergency rooms or take them to school and think they're candy. And the market is replete with those willing at all costs to make a buck and don't care who they harm in the process.
Thank you, Tony. Dr. Sal, sorry, Dr. Oshman had her hand up. If you don't mind, I saw her hand up first.
No,
Yeah,
okay.
I just wanted to make a few comments. There's a difference between medical marijuana and recreational marijuana, whereas medical marijuana is really more regulated. You have someone behind it advising you. Whereas recreational marijuana, anyone can get their hands on. They can use as much as they want. They're not told anything about it. The warnings that it's more concentrated than it used to be, and it can become more concentrated if policies aren't made keeping these lower THC potency caps going. So it's really for public safety. Also, people have been mentioning the cannabis use disorder, but you also have people with cannabis withdrawal syndromes. And people don't realize that you can withdraw from this if you're using it daily, if you increase the amount of THC that's in the marijuana that you're using. They don't associate the withdrawal from the marijuana because it takes a few days before it really kicks in, where you're actually seeing symptoms. And the symptoms can be sleep irritability. It could be craving for an appetite. It could be anxiety. It could be abdominal cramps, muscle aches, tremors, headaches. So there are a lot of things that go along with the withdrawal syndrome that people don't notice because it is occurring a few days after, and it can actually last for several weeks. So, these are things we have to consider. It's a public safety issue, and I think the legislators should consider these potency caps very seriously and try to keep it from happening in the general public.
Thank you so much, Robin. Dr. Oshman is the board president of the Fairfield County Medical Association, and I see that the president of FCMA, Dr. Feuerstein, also has his hand up. So if you'd like to speak next, and then First Selectwoman Carlson from New Canaan.
Thank you all. I'll keep it very brief. I work in the emergency room yesterday, and I keep on seeing people coming in with cannabis hyperemesis, meaning they cannot take anything orally. They have to be admitted to hospital. It's thousands and thousands of dollars to the insurance companies and to us. And this is happening everywhere. If you go to the pediatric unit, you're going to see hyperemesis all over the place. You're going to see cannabis psychosis. I mean, we got to have some caps. It's as Dr. Oshman quite rightly said, I prescribe medical marijuana. I'm a physician that does that. I know what I'm doing, but you cannot equate the two. It's absolutely criminal. So please do something. And finally, I'm working with Dr. Anwar, who asked me to come to this meeting so I could report to him, and I will report all things, and hopefully we can do something, because this is it's quite concerning what we see.
Thank you so much for that. And having Senator Anwar be a medical doctor in charge of the Public Health Committee is such an asset to us. The select person from New Canaan.
Thank you. I have to jump off, but I wanted to say, I have and I see Paul Reinhardt on here, so I'm thankful that he's here representing our community and sort of this issue. But I want to first state that I think we're going to look back at this legalization as putting tax revenue ahead of both the physical and mental health of both children and adults in this state. I was really disheartened to see this happen a few years ago, and was working with Paul to try and get this bill stopped, but we lost that fight. I want to talk about, no one is talking about both kids and adults driving high. I happened to witness an accident in Stamford where two young men hit a parked car. They were so high they hit a parked car, jumped out, threw their smokes away before the police got there. And and I said this at the time of legalization, we put the cart before the horse. We have no way to enforce. We enforce drinking and driving, but we don't have a way to enforce driving while high. And a lot of our youth are doing it as well. I mean, I talked to Tom O'Day, and he said that they're starting to capture that data, but we need to force that data to be captured, because it is unsafe on our roadways with the number of high drivers that we're having. And also, the health impacts of healthy adults of these substances and children, not only the mental, strokes are being linked to it. I think we really need to start to, bring more of that data into our legislators, because it is a horrific thing we're doing to our country. I mean, not just Connecticut, and it's all for profit. I don't have a problem with medical marijuana, but what we're doing to everyday Americans is tragic.
Thank you so much for that really strong statement, and how horrible to actually watch that happen in Stamford in front of you. I know we're almost at 11. We scheduled this to go for up to an hour and a half, but I want to be mindful of folks' time. So we have two other topics to quickly run by you, and and we've been sort of alluding to this, but I'm going to let Nicole Hampton talk about the silos in substance regulation and enforcement, and what maybe could be streamlined. Nicole?
Thank you so much. Kaitlin's actually going to start us off with the different agencies.
Okay, thanks.
Thank you, Nicole. Hi, everyone. My name is Kaitlin Comet. I'm a program manager at Catalyst CT, the Hub. We are the designated Regional Behavioral Health Action Organization, or RBHAO, for Region 1, Southwestern Connecticut. So here I'd like to provide a general overview of the current structure of cannabis regulation, monitoring, and enforcement. As you can see, there are multiple agencies involved. Before I do that, I'd just like to reinforce thanking our legislators who have been champions in supporting underage youth cannabis prevention and safe adult use. Our state is frequently recognized in our spaces as forward-thinking and taking those efforts to put in protective factors. So currently this structure works on the entire structure of cannabis regulation does work on a case-by-case basis. And as Margaret mentioned, we do see inconsistencies and missed opportunities for efficient or productive regulation. Just to give an example, because I know some folks are on the phone, Department of Mental Health and Addiction Services, or DMIS, typically regulates tobacco compliance checks for sales to minors. If they happen to pick up on something that is an illegal cannabis product, they will then clue in Department of Consumer Protection, who regulates liquor and cannabis compliance checks, and then hopefully looping in local law enforcement that enforces sales violations, minor protections, and licensing issues. So there's a whole lot of entities involved, and we haven't even included zoning here that does have influence as well. But at times it can be unclear who is doing what and who has done something about a case already. It can also be confusing who reports to who, and what the proper procedures are. So good foundation, and I think we can do much better in creating stronger procedures and communication avenues. So now at this time, I'm going to pass it to Nicole Hampton, who's going to go into more detail with you and review our policy asks.
Thank you so much, Kaitlin. So like others have mentioned before, the key issues in monitoring and enforcement are the unlicensed retailers, smoke shops and other stores operating without proper licenses. Also the licensed retailers selling the illicit products, selling unregulated cannabis or other substances, the product compliance, the THC beverages or high potency cannabis, are they really adhering to the Connecticut laws, and who's monitoring that? It's, across different agencies. Advertising violations. I know we all know the billboard on Westport Avenue in Norwalk that's been up for about 4 years now, violating our laws. Who actually enforces this and how? Is it DCP or is it our AG? And of course, the underage sales. And then we have enforcement gaps, right? The coordination challenges. Who reports the violations? Who is responsible for removing non-compliant products from shelves? Who imposes fines on violators? Which entity has the authority to shut down locations? And then there's the lack of clear protocols. When violations are identified, reporting and enforcement protocols are often unclear. Communication between agencies and law enforcement is not standardized. So our proposed actions are to create a unified substance commission to centralize monitoring, compliance, and enforcement and reduce the overlap to fill the gaps. Develop a comprehensive database, track retailers, licenses, compliance records, violations across all agencies. As mentioned previously, talking about the different JRE boards where you can violate in one town and it doesn't necessarily, transfer over to the other towns. So some kids, they have a first violation, 5 different towns. It's not really pulling everything together. And then clarify and enforcement responsibilities, establish clear guidelines for each agency's roles, reports violations, remove products, fines personnel, shuts down locations, and coordinate with local law enforcement. Enhance our cross-agency communication. Have a regular meeting between DMIS and DCP and DRS and local law enforcement to address ongoing issues and align strategies. So in conclusion, a comprehensive approach to monitoring and enforcement is critical to address the current gaps in Connecticut's substance regulation. By improving coordination, clarifying responsibilities, and centralizing oversight, the state can better protect consumers and uphold compliance standards. Establishing a substance commission or rebranding the liquor commission to include all substances is essential to streamline efforts and keep our communities safe.
Thanks so much, Nicole. And I noticed Rep. Giuliano actually talking about the Liquor Commission and a Substance Commission just a couple minutes ago. Any comments from our legislators on this? How feasible is this? What can we do to kind of avoid gaps and inconsistencies and things like that? I'll add that Nicole sits on the Alcohol and Drug Policy Council at the state level. And Nicole, they haven't really been talking about this piece, have they?
There's conversation, but there hasn't been, an actual substance commission established.
All right. Well, we'll hope
Mark,
that we
can I
can.
ask a question?
Sure. Sorry, Sal. Go ahead.
This is to Nicole, and Nicole, Nicole, and this is Dave to our legislators. Have you been meeting with Nicole and been down and try to get this forward into legislation?
Well, we've talked to legislators in the past, and like, for example, like a few years back, you had Vape-Wise in Norwalk. Thankfully, like the chief and everyone else is trying to handle this on a local level, but Vape-Wise was fined like 8 times and still not shut down. Or once they shut down, they'll reopen under their cousin's name, which I mean should not be allowed. Obviously, if you're a liquor store, you get a fine, you have a hearing. I think the same thing should be upheld for any substance, not just liquor, and especially the smoke shops.
Yeah, because they're going under different LLCs, and they have to go get the different LLCs. And there's been bars in Norwalk that would change different names. They'd bust them for underage drinking, and we know we have a lot of underage drinking in the town of Westport, and seems like some restaurants don't get in trouble for it. So, and even in Norwalk, I see Norwalk. I know the chief trying to do his hardest in Norwalk, but it's the same thing over and over again. They change the LLCs, so you have to go after the LLCs or shut the whole place down in general and not make them come back. Right, Nicole?
Well, I've seen the Liquor Commission shut down restaurants in Norwalk, but for example, most recently you have the smoke shop in Stratford that was caught, illegally selling THC and liquor nips out of their back door without a liquor license. Of course, the people were arrested. The manager was arrested. The retail clerk was arrested. But now they're back open a day or two later. The people that were off that day are now running it. So, like, that should not be allowed. That would not be allowed by the Liquor Commission if a restaurant was shut down.
Exactly. The license should be taken away permanently.
That was a good example, Nicole, that was just in the paper last week. So I'm going to move on to our final topic here. And thanks to everyone who's still with us. You might have been noticing that some of what we've been talking about is, relates to enforcement or counseling and psychoeducation for youth. Things that, it's like we're really talking about some policy changes that could be made, but there will always be an impact on need for funding. So we do want to tell you what's been going on with the Cannabis Prevention Recovery Services Fund. Kaitlin will start and then I'll wrap it up.
Yep. Okay. Thank you, Margaret. So here are the latest numbers in cannabis retail sales of this year by month, as reported by the Connecticut Department of Consumer Protection. And just to remind folks, we will share out the slides that contains all the sources to our content. So in November 2024 alone, the adult use cannabis market contributed to more than $17.1 million. And the medical marijuana market, which we do see declining here, recorded more than $10.3 million in sales for the same period. So that's totaling $274 million. And to remind folks—
in 1 month.
In 1 month, yeah. And to remind folks, 25% of cannabis tax revenue is allocated for the Substance Abuse Treatment and Prevention Fund. Next slide, please. So with that being said, here's our breakdown of the estimated amount of cannabis prevention funds. So based on those exact numbers from DCP, 1 month cannabis sales were around 17 million. We took 20% of that as according to tax revenues, and then 25% of that number for the prevention and recovery allocation. Taking that monthly number, applying it for a year, we estimated around $10 million allocated to the Prevention and Recovery Services Fund. Again, that's for a year. So in my position of the RBHAO of Region 1, I am pleased to announce that DEMIS has funded the 2 Connecticut Prevention Coalition grants to be awarded to 2 coalitions per DEMIS region. So this grant will be funded over 2 years for our 2 grantees, Positive Directions, a collaboration of Westport, Wilton, Weston, Norwalk, and New Canaan, and Trumbull's Prevention Partnership, a collaboration of Trumbull, Easton, and Monroe. So that's a total of $57,000 over 2 fiscal years dedicated to the prevention of illegal underage cannabis use. So that number came from the cannabis revenue dollars, which again, for a year, $10 million allocated for Prevention and Recovery Services Fund. So I'm going to turn it over to Margaret now, who's going to speak more on those impacts.
I'm just going to say how, number one, how grateful we are to have received those awards. I know Melissa from TPOD and I are really happy to be able to coordinate on behalf of our local communities. And so 8 different communities will be served through these 2 grants in Region 1, but Region 1 is 14 towns. So other towns weren't lucky enough to get this additional funding. And I would also say when you look at that amount of money, $57,000 over an 18-month period, it's not a lot. It's more than the communities have. If you were at our legislative forum last year and we said there are towns that only get about $3,000 a year for prevention, it makes a difference. But when you think about all the different things we've been talking about here today, and especially the need for enforcement and counseling and outreach to kids and families, I just think that there's clearly a lot of money coming into the state's Prevention and Recovery Services Fund, and we would love some transparent reporting on where it's going, how it's being used. What we know is, $10 million we estimate came in tax revenue from cannabis to the Prevention and Recovery Fund in the last year, and just over $500,000 is going out to communities around the state. Other uses of the money are that, Kaitlin is a full-time cannabis program manager for the region. She has a counterpart in the other 4 regions of DEMIS, and there's one at the state level. And then there's, a state website and a state campaign. But it looks to me like there's a lot of money that we could be using to address some of these problems. So I think we'd ask the legislature to maybe look into some kind of regular reporting, transparency, and maybe more of the money coming out to the communities, not $500,000 out of the 10 million, because there's 169 towns out there. Yeah, I think that's what we wanted to say. Any comments on the funding? This is kind of like the opioid settlement funds too, right? Like we're all looking at, it's rare that there are new sources of funding to the state. And at the community level, there are many, many needs. And we're all looking at where does it go? How is it being used? How can we maximize the benefit? Any comments or questions on this? I'm trying to see oh yeah, Dr. Oshman.
So I was wondering, the places that are illegally selling marijuana, do they pay taxes? And if they don't pay taxes on what they're selling, they're competing with those who do. And it should be pointed out that the state is losing money by allowing these places to continue to sell it and compete with the honest people who are working with the regulations.
Yeah. So, right, because what Kaitlin and I were just sort of estimating is the amount of sales tax revenue coming into the state from the licensed retailers. And if we've got the black market really being where a lot of folks are getting their stuff, that's just also a missed opportunity. I mean, that happened in California, right? The black market for cannabis outperformed the legal market by some kind of factor of like 10 within about 2 years. I'm just looking at who some of our legislators are who are still with us. Rep. Hughes, Rep. Johnson, haven't heard from you yet. Rep. Steinberg, wanted to see if any of you had any thoughts on the funding part and whether we can get any kind of report on how the money is going to be used and what's coming out to the communities and so forth. Oh, and Rep. Bertiliano is still here. putting everybody on the spot.
You did. Yeah. Hi, Margaret. I'm having to run to another meeting, but I just wanted to stay for the end of the presentations. I appreciate all this information. I think that not sitting on public health nor appropriations or even revenue, those would be the folks to speak with to give you that update. But I know that I've spoken with some of our colleagues in the building who, we want to be vigilant to make sure this funding remains true to the intent and purpose. So I think that'd be really important to hear from you all if it is working out that way.
Thank you. Well, I don't see any hands up. We covered a lot of different topics, mostly related to cannabis, but some more generally related to just substance regulation and enforcement. We are really looking forward to working with you legislators this session on any bills that you put forward. Keep us posted on what you're trying to accomplish. And come to us for, questions or feedback from those of us who are working on the ground. I want to thank everyone who is here today and point out that we have I think over 10 legislative prevention coalitions represented. We have, I think, at this point, probably 12 out of the 14 sectors represented. So those who didn't speak are involved in this work. We have school people, we have youth, we have parents, we have law enforcement, we have healthcare people, we have the nonprofits, we have the substance providers. Really, please see us as a resource and come to us with questions or feedback. Let us help inform you on what's happening on the ground. And at this point, I see, Tony Boucher's got her hand up. So welcome the comment. Any final comments, anyone else? So please, Tony, speak, and any final comments, please throw them in the chat. We will send the slides out to everybody who was here today. So thanks.
Oh,
Tony?
so Margaret, I just am so happy to see such a great group of diverse advocates and interested parties on this very important issue. That wasn't always the case. So hats off to you. This is terrific. Just a couple of things that kind of bring me back to the many years ago, 2015, 10 years ago in the legislature, when we were debating this issue in its early days. We had an ER nurse that was a state representative in the House, and she would talk about, and there's doctors on this call, so they could, let me know if this is real or not. But she, as an ER nurse, was still working. Remember, it's part-time legislature, so she was still working in the ER. And she would tell me that, Tony, marijuana stays in your system for up to 30 days and that it is cumulative. So if you are imbibing over that 30-day period, the more you smoke, the more you have in your system. So it's additive rather than it leaving your system like alcohol, after 8 hours or 12, and it builds up. So that's a concern and something medically that should be, I think, discussed, disclosed, if in fact that's real. And there are doctors working in that area, they might know better. And also my reaction to the chart you had about medical marijuana usage going down over time and recreational going up. And I just have to tell you that those advocates early on for the legalization actually wrote white papers and had it on their website that their strategy to get to legalization, which was their goal, was to use medical as a way to get there. Get people comfortable with the idea, make it look like it's benign, that it's healthy, and then go for what their real purpose was the recreational market. And you're absolutely right. It's all about the money. It is all about making a profit. And they don't care how many young people they lose in the process, because there's going to be a whole nother group of young people, especially if they increase the potency so that it becomes addictive. There was a time when marijuana was considered non-addictive, but with the potency increases to 50 times or 100, then you do have addiction. And recovery world does know that when they get those clients that come to them. So that's just, a few things that I learned. There's many more things, but I'm not going to bore you with the hundreds of pages of documentation I have. But those are the things that strike out at me and I thought was, pertinent to your conversation. But overall, I'm just absolutely so pleased to see this group together and interested and that you've, organized this. It wasn't the case so many years ago. And so hats off to all of you and have a wonderful holiday season.
Thank you. You too. If anyone here, legislator or coalition member, anyone has any burning final comments, please just raise your hand or speak out.
Margaret,
Not
I want
really
to thank.
burning, but
I
I
hear
wanted
two
to let you
different.
know that I could use all the help I can get. I didn't talk because I thought it'd be best to give other legislators an opportunity to hear from you folks. I've sort of been on the front line on this one for the past few years, trying to do the best we can. I want you to know that I am aware of all the issues that you speak of. I could use some more ideas. I learned a couple today that I liked. I do sit on appropriations, and we worked real hard over the past budget season to make sure they tried to take the money, the dedicated money, out of the prevention funds into somewhere else. It's a consistent fight. I mean, I really like what you all had to say. I don't know what other states are sort of looking at what we're doing. In fact, we've heard from many that said, my God, don't do what Connecticut did or Colorado. We're about as bad as it gets out there in the country, but we'll see what we can do.
Thanks, Dave. And that's interesting. If you have folks in the Appropriations Committee who are trying to take the cannabis prevention money out of that fund, please come back to us and let us kick and scream. I mean, of all the huge amounts of sales revenue, of sales tax revenue from cannabis, only 25% is ever going to go to prevention and recovery. And the vast majority is going to be going sort of in perpetuity to the social equity fund. I'm not even sure why it's a 75-25 split. I don't know. We've talked about that in past years. Like,
wasn't there like a build-up period for social equity? Haven't we? I didn't even think we started to put money into prevention. And I'm happy that everybody got their $57,000. But my God, I mean, you want to talk about a drop in the bucket? It's embarrassing.
Well, and yet everybody is 10 communities in the state got 57,000. Yeah.
Margaret?
Sal?
Margaret, it's Sal. Hi. I just wanted to make sure I thank everybody on this call, and especially my really good friend, Senator Boucher and Chief Walsh, and all our delegations that came today. This whole group is trying to work for a purpose, and thank you, Nicole. And we're going to get there. Slowly, but hopefully we'll get there. Thank you. Thank you, Margaret.
Thanks, Sal. All right. Well, I'm looking at the faces on the screen. I know people are hopping off, but I appreciate everyone who's here today. Our members of our coalitions, our legislators, our speakers today. Thank you all so much. And we'll send out the recording and the slides after this meeting if you're registered. And happy holidays, everyone. Take care.